Dear chairpersons, distinguished guests, it is always my pleasure to address this significant educational event taking place every year in the context of the International Thalassemia Day in Cairo, in Egypt. And I would like first and above all, before my presentation, to pass on the heartfelt regards and sincere appreciation and congratulation of the President of the Board of Directors of Thalassemia International Federation, Mr. Panos Iglesias, who due to unforeseen commitments is not able to greet, but nevertheless remembers the great efforts made by healthcare professionals, patients, families, governments, and competent authorities in this part of the world and in Egypt itself in promoting policies for the prevention and management of thalassemia. And please accept his sincere gratefulness for these efforts. So my part, I've been given a title referred to as Unmet Needs and Global Efforts in the Control of Hemoglobin Disorders. And I'm very thankful and very privileged to speak on behalf of the patient's perspective with regards to the control of hemoglobin disorders globally and some reference particularly in the region. I have seen that the thematology of this conference is really interesting and truly innovative aspects are going to be covered. But in my presentation, I will be covering and focusing more on basic aspects of how effective control of these disorders can be achieved and what are the efforts towards achieving this effectiveness. So in this distinguished audience, there is no need to introduce the work of Thalassemia International Federation, with which you have been collaborating, most of you, for so many years. And you are very well familiar that it strengthens, promotes, and safeguards the rights of patients for equal access to quality health, social and other care. And it is this vision of the Thalassemia International Federation that mandated its mission. And the mission of this federation, since its establishment, is still the same: the support for the development and implementation of disease-specific national control programs that include the components of prevention and management alike in every country. The Thalassemia International Federation works in official relations since 1996, 2017, 18 and 19 with World Health Organization, United Nations, European Commission, and the Council of Europe. And amongst its most important pillars of activities in the context of its work is the educational program, for which we can safely state that this has a truly measurable impact across the world. We are all familiar in this distinguished audience of the long, difficult and complex journey of the patient with a hemoglobin disorder. And here is the example of a patient with thalassemia. That early and accurate diagnosis is very much needed, timely, and the patients have to be referred to expert treating physicians with knowledge and experience on how to treat this disease. And these healthcare professionals are also responsible to develop a well-trained, well-coordinated, multidisciplinary care and access to patients to reference expert centers with continuous lifelong education for their knowledge and experience in this disease. It is important to understand that development of disease-specific social care and introduction of research and innovation and participation in clinical trials are important aspects with the focus on the effectiveness. But it is also important to remember the meaningful patient engagement on behalf of patients that are well trained and receive patient education on their disease, its aspects of prevention and management, but also on regulatory affairs and policies in their own country and across the region. And one of the most important aspects for the effective control of these disorders includes the presence of universal health and social health coverage. A chronic genetic disease cannot have effective control and manage unless it is nationally coordinated and the health and social care system can fund the needs of these patients, both for their management, but also for the prevention of the disease. They need national registries to guide them on the development of disease-specific policies, and prevention program is an integral part of the effectiveness of the control of this disease, as well as other chronic genetic diseases. We are fully aware of the existence of best practices, successful examples in a number of countries, initially of the Southern Mediterranean countries, that have provided ample evidence of how to effectively prevent and appropriate manage, with such as seen on this slide, with high survival, impressive age distribution curves, reduction of annual affected births, but reduction of annual deaths as well. And the four important pillars for effectiveness, of course, is, as I previously said, prevention strategy, quality of blood transfusion, iron load monitoring, and chelation, as well as access to well-organized multidisciplinary care, all of which need to be encompassed in the national healthcare system of the country that is fully funded. So from 1925, when the first descriptions of the thalassemia were available in the published literature until today, there has been a significant progress in science and medicine. And we now know, as we have seen, high survival, social inclusion, and even cure of thalassemia. And we are looking at 2 patients that have been cured in 2021 with a new gene therapy product. Now, the bricks underneath, however, are representing the different levels of provision and quality of care provided, because good care, management and prevention are unfortunately provided in a very small percentage of countries around the world, and different countries are at different stages on the provision of these optimal prevention and care. Now, in the 3-year joint work of World Health Organization with Thieves between 2018 and 2021, a key deliverable has been the preparation and publication of the Global Thalassemia Review. What is this review? This review is a capture of the patient's perspective across the world in 48 countries across the 6 regions of the world on how they feel their treatment is provided, the extent and quality of the services they are provided in their country. And this report has been complemented with published literature and official reports from treating healthcare professionals, researchers, and even from competent health authorities in the different countries with which Thieves is in official relation through Memorandum of Understanding. What has this report included? It included the epidemiology, the prevention, the effectiveness of prevention program, blood, and the global scene today, iron load monitoring and chelation, how MRI is being used, and how patients access multidisciplinary care, social health protection. The review included a generic model on how to estimate the cost of the disease, as well what has disease burden means, and what are the medical, public health, social and economic repercussions that each country has in the absence of effective prevention and management. And what has this report shown is that more than 80% of the countries the patients in this country have many and complex unmet needs across, within the countries, within the regions, leading, of course, to huge inequalities, which are prominent within and across the regions of the world. Briefly, a very big percentage of the countries have no nationally coordinated and funded prevention programs. Most of the programs that are mentioned publicly or within official reports, they are city-based, regional, or hospital-based. There is no national coordination, and most of these programs and policies are not funded by government. And only 5.8% of the countries are actually under nationally coordinated funded disease-specific programs, and these are the countries which reflect the best results in survival, quality of care, and social integration. And even in 4% of the countries, there is no control program at all in place. Now, with reference to health and social care, this is also very impressive, the results of this global review showing a very great percentage of the patients and healthcare professionals reporting that they are providing basic care to patients. And by basic care, we mean only blood transfusion and iron chelation. But only less than 30% of this even basic care is actually effective based on certain parameters, as these are described in the recommendations of the international Thieves guidelines. And less than 5% have actually access to multidisciplinary care, access to reference expert centers. Less than 3% have actually access to disease-specific social care, and a very big percentage of the patients have very confined social protection measures. In fact, 97.8% of the countries, thalassemia is not a priority on their national health agenda, and 98.2% have no national registries to guide the competent authorities to develop specific focus policies. What does this mean? That there is absence of political commitment in the greatest majority of countries. A snapshot of the blood transfusion global scene in the context of this report also reveals the many challenges patients are facing with regards to adequacy and safety of blood transfusion therapy, with regards to the median annual donations in the low-income, medium, and the low-income countries, reaching 6.8 and 5 per 1,000 in low and medium and low income countries respectively, as compared to nearly 32 per 1,000 donations in the high human index development countries. There is very much need for structured hemovigilance programs, despite the fact that many countries have quality transfusion services. Structured hemovigilance programs are absent in the majority of the low-income medium countries, and impressively and sadly enough, there is still a considerable percentage of patients receiving whole blood instead of component separation. There is a lot of reliance on replacement donors, family replacement donation, which is something that we would like to change to 100% voluntary non-remunerated donation. And sadly, there is also hidden paid donation in some parts of the world. There is considerable shortage, at least in the 2017 published report of the World Health Organization, 35 million blood product unit shortage in these parts of the world. And very importantly, quality, safety, and effectiveness of blood transfusion therapy in our patients, in transfusion-dependent patients, is very limited data for this in these parts of the world. And what does this mean? Well, this is reflected in the patients reporting frequent postponement of transfusion therapy, transfused at hemoglobin levels below those recommended in our Thieves international guidelines. A great percentage of patients have not heard of hemovigilance programs, therefore they are not reporting to hemovigilance programs. They are not aware of how their blood is processed and a great percentage reports receiving blood irregularly or very rarely filtered, which is one of the most important parameters for the safety of blood transfusion therapy in our patients. This is a complex but an easy to interpret slide, just translating the percentages of the patients reporting postponement, reporting having pre-transfusion levels below 9, between 7 to 8, and below 7 grams per DL for the pre-transfusion hemoglobin. Reliance on family and friends replacement donation in 60% of the patients reporting, and of course a great percentage, nearly 90%, of not being aware of the transfusion services in their country or in how their blood is received. So with regards to effectiveness of iron overload control, and control means iron load monitoring of heart and liver mainly, plus appropriate chelation. Now, Thieves trying to score the effectiveness of iron overload control in a number of countries, members of Thieves, including countries of this region we are speaking in now, based on the mean age across the country, and based on the mean liver and heart iron, as well as on the percentage of patients with heart and liver complications. It has been a very difficult exercise because of the paucity of reliable data on these issues. And this is a very important plea on behalf of Thalassemia International Federation to publish results, to collect results and analyze them appropriately so that we can assess the effectiveness and guide our competent health authorities on what is needed. Competent authorities cannot act without reliable data. And what this slide shows is that where there was reliable data on effectiveness based on mean age and mean iron and liver iron, it demonstrates that most of the countries score C and D, that is quite ineffective control of iron overload. But many, the majority of the countries are scoring a red dot. And the red dot seen on this board is signifying and underlying the absence of reliable data to assess the effectiveness. That's a very important challenge we are all faced with. With regards to the Eastern Mediterranean region, which is part of the work of Egypt and other countries around the region, the Global Thalassemia Review underscored similar challenges. One must say that this region of the world has focused considerable attention, particularly researchers, healthcare professionals, the academia, and governments of these countries have focused importance on controlling this disease. However, we feel that we need more efforts to achieve effectiveness. There are challenges, as we have seen, with regards to the transfusion therapy, particularly with regards to the adequacy and in maintaining pre-transfusion hemoglobin to recommended levels. There are challenges in the voluntary non-remunerated blood donation practices. There are problems, challenges in MRI-based iron load monitoring, and particularly even if access to MRI is true, there is important absence of results on the quality standards of the MRI assessment. There is a very heavy serum ferritin reliance in the region, and that needs to change. And there is concern on the safety and effectiveness of some of the iron chelation. There is no evidence, but we would like to have evidence on the quality assessment and assurance of the generic drugs that are used, because 48 to 86% of chelation drugs used in the region are of generic formulation. So we need reliable results. to assess the effectiveness of these chelators and plan for further policies. Multidisciplinary care is very poor in this region of the world as well. And there is very limited data on how the patient involvement acts at the decision-making level. Access to reference centers is also very poor and is usually around universities and the peripheral treatment centers severely lack networking with reference centers wherever these exist. There are well-structured reference centers, and I could mention Lebanon, for example, and United Arab Emirates or Cairo University. But these are few well-established reference centers in the region. Medical expertise exists, and we're very proud of a number of healthcare professionals in the region, but it is again limited to reference centers or academic centers. National guidelines, we know, and we know that they exist. We know that some countries have developed national guidelines based on our TIF guidelines. But what it is important is to see the level of their adherence, and that will be related to the effectiveness of treatment. Another major missing gap here is the existence of national registries. In the greatest majority, apart from very few countries, no national registries exist, and therefore makes the decisions by the health competent authorities very difficult to be taken. And of course, the social disease-specific policies need to be quite strengthened in this part of the world. Now, global efforts for the control of hemoglobin disorders. We do not need to reinvent the wheel. I think that the COVID-19 pandemic has taught us how collaboration and how synergies can effectively improve policies, can develop new policies, and how we must revisit the knowledge and policies that already exist. World Health Organization has been working for the genetic diseases, and in particular thalassemia, through specific thalassemia and sickle cell disease resolutions for many years now. And there are national plans, and there are description of all the elements that are necessary for effective prevention and management for many years now in the context of a number of resolutions, but also many useful elements with regards and incorporated in other important resolutions, such as those of the birth defects and non-communicable diseases. Important elements for patient safety and patient and blood safety and availability. Look at the number of World Health Assembly resolutions on the blood safety and availability, and the development of action frameworks to advance universal access to safe, effective, and quality assured blood products. There is ample and high-level information and recommendations in these that governments have signed to adhere to, they have signed to promote. And this is the time to actually start investing in what World Health Organization has offered us, because thalassemia is a multi-organ disease. It requires a number of policies, not only for genetic diseases. We need access to essential medicines, sustainable health funding. We need universal health coverage, reducing health inequalities and poverties, taking care of the health of migrants. So all these recommendations and evidence are there within the World Health Organization. And we have regional offices, local offices that are ready to provide recommendations to every country. And there are a number of collaborating centers in the region as well. Now, other global efforts are of importance, but not of the extent of the importance of World Health Organization global effort. We can see the Association of Southeast Asian Nations, the so-called ASEAN, which is a multi-stakeholder initiative in which decision makers and healthcare professionals are participating, with a growing patient community involvement in the later years. Important countries like Indonesia, Laos, Malaysia, Philippines, Singapore, Thailand, and Vietnam are included in these ASEAN countries that are important because of their high prevalence and focus on thalassemia. And the aim, of course, is to capture the gaps and weaknesses, also capture the common challenges in this region of the world, and promote policies for improvements. It is in the context of the senior officials' meetings on health development that takes place held annually, and the health cluster within this is taking place every year. In the last years, Thalassemia International Federation is also participating, but again, we would like to see more strengthening in these parts of the world as well. Now, in the region of the world that we are in now, there is a Thieves current initiative referred to as the Thieves Forum of the Thalassemia Arab Societies. And this has been created around the end of 2019-2020. It's a patient-oriented initiative under Thieves auspices and contribution. The founding members being some of the countries that have given considerable focus on this disease for many years now: Jordan, United Arab Emirates, Lebanon, Iraq, Egypt, and Palestine. And of course, the mission is no other than to promote policy improvements, capture the patient's perspective, capture the gaps and the weaknesses in the region, within countries, but in the region. Common challenges, but also individual challenges, and through recommendations, pass them on to decision makers. One current action that we feel is going to provide effectiveness of this work is the creation of the Circle of First Ladies or Dignitaries, the launching of which will take place on the 20th of June. We feel that the creation of a Circle of Dignitaries will provide a better opportunity to pass on the recommendations to competent health and other authorities for the promotion of this disease, because policies are there, programs are there, but it needs more political commitment and a better coordination of what exists and strengthening of the existence. Now, on the top is what the European Union is doing. I was skeptical whether to put it on, but it's very important that regions, countries, healthcare authorities, patient organizations need to share experiences, need to build on successful policies and experience. And Europe has been very much focusing in the context of the rare disease policies on safe drugs, on clinical trials, on health technology assessment regulation, how to access and assess the quality and safety of drugs, the quality and safety of blood and blood products, not in the context of individual policies, but in the context of regulations. And regulations are legislations in each country that countries have to follow, because these policies go within the legislation. And perhaps other regions of the world can build on some of these policies and make their own more strengthened and more effective. Last but not least, are the global efforts of the Thalassemia International Federation itself. Needless to comprehensively go over this in this distinguished audience, but Thieves is fighting for the creation of reference expert centers, the assessment and support to become an expert centers, healthcare professional training through preceptorships, fellowships, online and in person, empower patient associations, which was the reason for the creation of this federation. But in an effort to support the patients, we have developed all these policies to support our patients' well-being. So we need to strengthen the patients through education and advocacy opportunities. Already you are familiar with the development of Thieves patient advocacy groups. What are these patient advocacy groups? They are patients that go through courses and they are very well aware of what the needs of their disease are, so that they can interact on an equal basis with the decision makers to support and document their case. We are working on the clinical data and patient outcomes collection. We have developed as TIF the registry, an electronic health record, as well as a generic model for the cost of illness. Countries can take benefit of this. They are provided as free services for the use of the governments and the centers. A registry is already complete, the cost of illness model. Guidelines is the first contribution. A measurable impact of these is already known across the world. And now we have the second version of the 4th edition of guidelines in the next days uploaded on a website at your services. Quality and efficacy of iron chelation generic medicinal products is a very important concern of TIF and is developing a huge project on that. But of course, very importantly, on ensuring that science and medicine bring pharmaceutical products and therapies that are affordable, accessible, and available to our patients, and they don't remain on the shelf. On the right side of the slide, we see the penetration of the generic medicines across the world. And in this region, there is a very high penetration of generic drugs, 85% in Jordan, for example. This is a pillar that TIF very much promotes, because this is a pillar that contributes to the sustainability and resilience of the healthcare systems. But we must ensure that generic drugs are going through quality and safety and effectiveness, efficacy controls, and that the survival and the effectiveness of the treatment of our patients is in no way and to no extent jeopardized. The industry also is involved with some global efforts, because the industry, or to a great extent, is designing and developing clinical trials, involved in innovation and research, but also innovation in the educational programs and in capturing patients' perspective. But we need transparency and early dialogue with the industry. So last but not least, we need a call to action. Well, I feel we are already belated, because there is ample knowledge, guidance, and recommendations from important official bodies and initiatives. Governments need to commit to adhere to these, and healthcare professionals need to advocate and work with their governments to provide them those tools that will help them decide. Patients and families need to remain in a meaningful and productive engagement with their healthcare professionals and governments. There is an important prerequisite here to develop universal health and social coverage. In every country, these patients need to be fully funded. A chronic genetic disease that starts from the birth of a child cannot afford to be out-of-pocket based services. So we need to improve patient outcomes, social integration. A number of countries have already done this. We have evidence that this works, and therefore we all need to work. And these are also part of the Sustainable Development Goals of the United Nations until 2030. Let us all respect to what we have all signed for. Thank you very much for your attention and hope for a productive, and I'm very confident of a very productive meeting. Thank you.